our GMMG CONCEPT trial, or in short, just the CONCEPT trial, is a trial specifically for people who have newly diagnosed multiple myeloma with high-risk disease. And then, of course, there's the question, what is high-risk disease? I will elaborate this a little later, but this trial looks at this population, newly diagnosed high-risk multiple myeloma, and investigates a new combination of 4 different drugs: isatuximab as a CD38 antibody, carfilzomib as a second-generation proteasome inhibitor, lenalidomide as an immunomodulatory drug, and dexamethasone, or in short ISA-KRD, as the combination, and investigates how effective and safe this treatment is in this population. Little step to further describe how the trial was designed. So it's a trial for both patients who qualify for transplant and those who don't, because all patients receive 6 cycles of ISA-KRD as induction, but then there's a difference. Either you go for transplant or you receive 2 additional cycles of ISA-KRD. Then all patients again receive 4 cycles of consolidation and all receive 3 drugs, ISA-K and R, for maintenance for 2 years. And the trial looked at the rate of MRD negativity. MRD, what is that? That's short for minimal residual disease, or also measurable residual disease. And that denotes basically that we cannot assess any tumor burden, any myeloma cells currently. We look with a sensitivity of less than 1 myeloma cell per 100,000 cells. And looking at this sensitivity, we could see that about 3 out of 4 transplant-eligible high-risk patients do not have any measurable disease at the end of consolidation anymore. And looking at the whole duration of the trial, almost 9 out of 10, so 87% roughly, reach this MRD negative state. And this is important because we know that MRD negativity is the strongest predictor for a longer progression-free survival, so for a longer time until the disease comes back. Currently, there are no specific guidelines for high-risk patients. That's exactly what this trial addresses, because there was this unmet need for the high-risk population, where you know that the treatment outcomes, that the response outcomes are not as good as with standard risk patients, but so far there have not been any high-risk trials, any specific high-risk recommendations. And our trials, together with 2 others from France and from UK, now was one of the first really looking at the high-risk patients. So coming back to your question, there's no direct comparison, but from the historic data that we have, which showed a median overall survival between 2 to 3 to 4 years, it compares favorably because we have, with a median follow-up of around 44 months, the median progression-free survival was over 6 years, and the median overall survival has not yet been reached. These results first mean several things. First, it's important, and we are happy that we can contribute to this, that there's more attention to the high-risk patient population, and this is one very important finding. Secondly, we can show that with this intense ISA-KRD treatment regimen, there is also a good and tolerable treatment option to really induce deep responses that last long, and that it could therefore be a preferred treatment option. So we will further follow up and look for a longer follow-up to see how the data matures with regards to progression-free and overall survival, of course. In addition, we will have a closer look at certain subgroups, which means patients with specific characters, because our trial is actually also one of the, to my knowledge, the largest prospective high-risk trial, with overall 245 high-risk patients included. So this really allows us to also look at different subgroups, and that's what we are working on, for example.